Thank you for joining us for this webinar, Understanding Allergies in Dogs and Cats. My name is Shelley. I'm the content manager at Revival Animal Health, and I'm excited because this webinar, Revival's Director of Veterinary Services, Dr. Marty Greer, will be talking about food allergies, environmental allergies, flea allergies, so many more. So all the allergies. So Dr. Greer has more than 40 years experience in veterinary medicine with special interests in canine pediatrics and canine reproduction. She received her Doctor of Veterinary Medicine from Iowa State University in 1981, and she has served as Revival's Director of Veterinary Services since 2019. So welcome, Dr. Marty Greer.
Thank you. And this, as always, we have this big topic, and it's really hard to get through everything. So I'm just going to start off with that licking noise that you wake up in the middle of the night with your dog, your cat, slurp, slurp, slurp. You can hear that. You can just hear that. Oh my gosh, that is so annoying. And we need to figure out what we can do to make our pets more comfortable. So we're going to talk about the definition of allergies, how they manifest. We'll talk about food allergy, environmental allergy, drug allergies, contact allergies, flea bite, vaccine reactions, what you can do to treat these, and then a spoiler alert for human allergies to cats. First of all, what is an allergy and what's the difference between an allergy and an intolerance? What are allergy thresholds and what are the routes of exposure to allergens? So an allergy is an immune response. It's a damaging immune response by the body to a substance to which it has become hypersensitive. You can't be allergic to something you've never been exposed to before. You can have intolerances to that, but you can't be allergic to it. So the first time you eat a peanut or a piece of shellfish, or your dog eats, a piece of chicken, they can't be allergic to it. They can't be allergic to the first vaccination that they get because they've never been exposed to it before. But after that, you can develop a damaging immune response, which means it's a negative effect. An intolerance is when you have some kind of a difficulty digesting, absorbing a substance, leading to some unpleasant symptoms. So it doesn't require an immune response, but it's an intolerance issue, usually because of an enzyme that you're lacking. So if you take a look at these, I personally don't tolerate peppers, which is why I picked this lovely pepper-covered pizza. I personally don't tolerate those, but it's not an allergy, it's an intolerance. But if we do peanuts, for instance, if you're Big Bang, the TV show Big Bang Theory followers, you'll remember the episode where Leonard took his friend to the ER because he deliberately ate peanuts to try and delay someone entering into a party. So this is what an allergic reaction can look like, and it can be really severe. It can be to shellfish, it can be to peanuts. So you'll see lots of packaging of like cookies and potato chips and things that'll say, if, caution, allergens was processed in a plant that may have contained peanuts, because some of the people that are allergic to some of these products are highly, highly intolerant. For instance, they don't serve peanuts on airplanes anymore because just sitting in the airplane was enough. Not even eating the peanut was enough for people that were highly allergic to some of these items. So an allergic response is really severe and can be life-threatening. So it's not something that we want to take not seriously. How do we diagnose allergies? So I see dogs every day in my practice. They walk in the room, they come in with some kind of a symptom, and my knee-jerk reaction is, this is an allergy. And they're like, yeah, but you like, how do you know that? Well, because I've seen dogs and cats for 44 years that I know have allergies. So it's based on physical exam. Does the pet have skin lesions? Does the pet have a runny eye, runny nose, ear infection, any kind of a rash on their skin? Are they chewing, biting, licking, scratching? Anything that would indicate that they're itchy. Part of it is their history. So you'll come in and you'll tell us that in the middle of the night, you hear your dog licking his feet, or you'll see a rash that breaks out. A lot of it's based on the time of year and the age of onset. Like I said before, you can't have an allergic reaction to something you've never been exposed to before. So we don't see pollen allergies and mold allergies in young dogs that are under a year of age. Before their first summer, they can't be allergic. In their second summer, they can. So age of onset between 2 and 4 is really common for dogs with allergic reactions. The same with cats. Time of the year, again, is really important because a lot of the allergies that we see are based on tree pollens, grass pollens, all kinds of things that bloom. If you live in Florida, that's kind of year round. If you live in Wisconsin, it's, starts in April and it goes until October, but then we have 6 months off. That's the only really good thing about living in the cold weather, is at least we have a break from the allergens because there isn't pollens and molds in the wintertime. We don't have those outside. Now, sometimes it takes a food trial. And so you may have told us that you've tried some different diets, and that may tell us that your dog is either, or cat is either allergic or insensitive or intolerant of something. So that's an important bit of information for us to have when we're taking a history on your pet. We may have tried a fish oil trial to see if that reduces their responses. We may do a drug trial to see if the pet responds to these particular drugs, and we'll talk about what those are. Did he or she get better on that drug? And that's going to help us to know if the pet had an allergy. If they don't get better, it's probably not an allergy. If they do get better, it probably is. So we're going to sort those things out. And then there's skin testing. And really the only accurate way to know what kind of allergy your pet has is by doing skin testing. And I'll show you what that looks like. But unfortunately, the saliva tests and the blood tests that are on the market are typically not terribly accurate in helping us. So I'm going to encourage you not to spend your money on sending off saliva samples or going to the vet and having a blood sample done. Because if you talk to the dermatologists, they're going to tell you that skin testing is really the only way to know for sure for pollens and molds. They're going to tell you a food trial is really the only way to know for sure about food. So I think it's really important that you know before you go in and have the conversation with your veterinarian what your choices are and why you would pick those. I tell clients about these frequently. I'll say, well, I'm not going to do a blood test, even though you may Google it when you get home, and you'll say, well, why didn't Dr. Greer say that we could do that? Well, the answer is because it really doesn't give us that accurate of information. So I want to be really crystal clear about what works and what doesn't work. The other thing that you need to know about allergies is that there's a threshold level. So you may have a dog that's allergic to some chicken in their food, and they may be allergic to the house dust mites that you have in your house. No matter how carefully you vacuum and dust, you still have house dust mites, and they may be comfortable until the third allergen hits them, and that's the summertime. That's when the ragweed pollen in August and September. That's when the tree pollen and grass pollens happen in the spring. That's when they add all those allergens together, and they go from I'm okay, I'm tolerating it, I'm not scratching, itching, licking, biting, chewing, to oh my gosh, now there's something blooming in the garden. Lilacs are blooming, or ragweed is blooming, or goldenrod, or whatever it happens to be, and that just puts them over the edge. So you may see allergies wax and wane based on the time of year and the kind of exposure that your pet has. They may be better at your house, but you go to your mom's house or your uncle's house, and the dog may have an allergic reaction to something. So it's important to realize that allergens are additive. And if we can control one of the allergens, we can eliminate it from their environment, then we may be able to go back to a comfortable dog or cat without having to use any other interventions. So it gets a little bit tricky. What kind of allergies are there? What's the route of exposure? Well, we can have contact allergies. That's something with intact skin, like the kind of soap you use. There's a TV commercial that there's a little girl playing detective, and she's scratching herself on the commercial, and they're advertising laundry soap that reduces the allergens that are in her clothes. So shampoos and soaps they can be allergic to. They can be allergic to wool. So if you have wool blankets or wool carpeting or wool jackets, any of those things, that can affect them even through intact skin. Broken skin can be something like a bug bite or a wound that can allow that allergen to get in. Inhaled are going to be the pollens and molds, and they're inhaled as well as contact. So that's kind of a combination. It's not just that they're inhaling the pollens, it's also that they're contacting them with their skin on their feet. I have one client with bulldogs, and she replaced the grass in the part of her yard that her dogs go out into, not her whole yard, but just her dog yard, with AstroTurf so that they weren't contacting the grass. We used to think that these were all inhaled, but now we know that a lot of this is a contact allergy. So they touch the grass with their feet, and they come back in the house, and then they're licking, biting, scratching, chewing. Third is going to be an injection. So a drug or a vaccine that they're injected with, they can have an allergic reaction to. They can be allergic to oral medications, food, and treats, and they can be allergic in their eye reactions from pollens, dusts, and molds. What do manifestations of allergies look like? Well, anaphylaxis is going to be the worst reaction. I just saw a Facebook post the other day about a puppy that had a vaccination and had an anaphylactic reaction, and those are very serious. We're going to talk about those. You can have delayed reactions, which are a little bit later. It's not the minute that you pull the needle out after the vaccination, but it's 45 minutes later. There are 2 or 3 days later. GI signs we can see. The symptoms we see if there's a GI allergy is going to be vomiting, diarrhea, and nausea. So it may be a dog that doesn't want to eat well, or a dog that always has diarrhea after they eat a particular product or a particular food. For skin, like I said, it's biting, licking, scratching, and chewing. That's oftentimes atopy or atopic dermatitis, really, really common, especially on the feet and the ears. And then the other thing that I'm going to be really clear about, and I make my staff aware of this, is you can tell me all day long that your dog is itchy, but you can't see an itch. You can see them bite, lick, scratch, or chew, but itching is a sensation. So we have to assume that they're itching. So, if my staff comes out of the room and says the dog is itching, I'm like, the dog is scratching, but the dog may not be itchy. It may be scratching for another reason. Maybe they don't like their collar. It may not be that they're allergic. Then we can see dogs that have GI and skin problems, both, and it's more of an adverse food reaction, not an atopic or allergic reaction. Then we can see the eyes. If it's involving the eyes, they'll be watery and inflamed. And if it's respiratory, we can see asthma, and we'll talk about that. So anaphylaxis is the most serious version of an allergic reaction. It happens in people, it can happen in dogs, it happens in cats. And it's a severe allergic reaction that has a very rapid onset. It can be to a bee sting. So, people that carry an EpiPen because of bee stings or because of eating something that they shouldn't. So it can be a very serious and rapid onset of allergic reaction. It can be to vaccines, drugs, antibiotics. If we're going to see it to an antibiotic, it's typically amoxicillin, Clavamox, which contains amoxicillin and cephalexin in the same drug class. It can be to reptile venom if it's a snake bite. It can be to blood-based products like blood transfusions and plasma. It can be food, but those are rarely going to be anaphylactic in dogs and cats, not like people that have the peanut allergies. And then they can be allergic to heartworm disease, heartworm itself. What are the symptoms of anaphylaxis? How would you know if your dog is having an anaphylactic reaction? Their blood pressure will drop. They'll have organ function problems with their liver, their kidney, their whole body just kind of starts to shut down. And it requires a really rapid diagnosis and resuscitation because of an immediate histamine release. So histamine is the chemical in your body that causes this allergic reaction. And it's released because your body has an allergic response to something that you were exposed to by eating, by a bee sting, by whatever. How does it show up at the emergency clinic? What does it look like at your vet clinic? It's not specific to any breed, age, or sex of dog. It can happen to any breed, any age, usually in young dogs and usually in medium to large breed dogs, but I've seen it in dachshunds and Yorkies, so it's not exclusively big dogs. It requires a complete history, so you need to come in with all the information you can when you get to the vet clinic. And these dogs will be walking along and suddenly they just go really pale. Their gums get pale. They collapse. They may have vomiting and diarrhea. There may be blood in the vomit. They may go into shock. They're going to have weakness. They may have seizures. They may break out in hives and have red, patchy skin. Their eyes may be uncomfortable, red, and tearing. There may be no known exposure. So you can come in and say, I have no idea what happened. And this actually happened to me. I'll show you a picture in a few minutes of a puppy that had happened to me. Was out in the backyard in the X-pen with my other puppies, and all of a sudden he just had this blowing up face. So it can happen. It can be rapidly fatal, but about 85% of patients will survive this, 85% plus. And probably it's higher than 85% because not all of these end up with the emergency clinics. How does anaphylaxis look to you? Well, when we say shock, it doesn't mean that your dog looks surprised. Shock is truly a physiologic response where their blood pressure drops. They're going to get really weak, really sick. Their gums are going to get really pale. So instead of being nice and pink, and on ultrasound, this is kind of cool because this is a relatively new finding. On ultrasound, you can see what the gallbladder looks like in these images. On the left-hand side, that's a normal gallbladder, that black pocket. But on the right-hand side, you can see a halo around the gallbladder. And that is a typical anaphylactic reaction because of the edema that builds up in the liver. It develops this halo effect. So if your vet is not sure if your pet had an anaphylactic reaction, they may want to do an ultrasound and look at their gallbladder for this reason. So it's kind of cool. But it doesn't mean your dog is like surprised. It means truly a shock reaction. Supportive care includes fluids, epinephrine, antihistamines, including Benadryl and steroids. And if you have a patient that has a history of anaphylaxis, you want to do a couple of things. One is avoid any triggers. So if you know they're allergic to a drug, you don't use that drug. You may not even have that drug in your house. I have clients that are so allergic to amoxicillin, I don't send it home with them. I have some clients that are so allergic to latex, we don't do any kind of tape on their dogs. If we have to put tape on, we have to figure out gauze or something else with no tape because they're allergic to the latex. So avoid the bee stings and the insect bites, avoid the drugs. If you do have a patient with this, have your Benadryl available, have your steroids, have your vet prescribe some prednisone to have at home. And if you're vaccinating your own dogs, never, ever, ever vaccinate when your vet clinic is closed. Don't do it on Sunday afternoon when your vet clinic isn't open. Do it on Tuesday morning when your vet is there in case there's an allergic reaction. You don't want to be without veterinary care if this happens. The second kind is a delayed hypersensitivity reaction. This is one of my Danish Swedish farm dog puppies. He was out in the yard. just doodling around with the other puppies in the X pen. And I went out and I looked at him and I'm like, oh my goodness sakes, what happened to you? So you can see his face is red and swollen. His eyes are puffy. This happened very quickly, just no known exposure, but obviously this was some kind of an insect bite because he hadn't been vaccinated. So it can be a vaccine, it can be an insect bite, it can be a drug reaction. Treatment is going to be steroids and Benadryl. So you want to have steroids and Benadryl, prednisone and Benadryl in your first aid kit in your house available to you. If you travel, take it with you because you never know when this might strike. You want to be prepared. Other GI, if we have a dog with GI signs of allergies, it's going to have vomiting and diarrhea. It may have limited interest in certain kinds of food, including the regular dog food that you feed. So if your dog is not a good eater and it's a breed that should be, say it's a Labrador and it always just kind of picks at its food, I would listen to your pet and say, do you have an allergic reaction or maybe an intolerance to one of the products in this food? And try a completely different food with a completely different protein and carbohydrate profile to see if that makes a difference. I've had a lot of people come in and they've said, yeah, my dog's just a really picky eater. We switch him to something different and they mow into their food and they're like, oh my gosh, like he was always underweight. I had no idea that his food didn't make him feel good. So it may not be bad enough for them to stop eating because they have to eat to live, but it may be bad enough that they're like, I'm just going to eat what I have to kind of fill my stomach. And then I'm going to hope for something better at the next meal. So please listen to your pets and try something different and go to the pet store, see if they have samples, go to your vet clinic, see if they have samples, see if they can make some recommendations, try some homemade diets at home short term, and see if you can come up with something that makes your pet feel better when they eat, because they're going to eat better if that's what's going on. Of course, the other thing, anytime we have vomiting and diarrhea, we want to get a stool sample to make sure that they don't have a parasite problem. We would hate to be treating for the wrong thing and assume it's an allergy if it really is roundworms, hookworms, whipworms, Giardia, coccidia, one of the parasites. If we see skin and ear manifestations of allergies, we're seeing those really commonly in veterinary clinics. It accounts for 21% of veterinary visits. That's the number 2 reason that we see patients at the vet clinic, dogs and cats. So I have people that come in, like I said, every day I see multiple clients for appointments, and every day they come in and they're like, so this is what's going on. I'm like, yeah, that's an allergy. Well, how do you know that? Because this is how allergies present. This is what they look like. The other thing to know is that 17% of dogs that have atopic dermatitis also have a food intolerance. Now, in general, food intolerance is not that common. It happens, but it's not super common. It's not as common as these other kind of manifestations. But if you have a dog with atopy, with chewing their feet, licking their feet, having ear problems, it may be a food allergy or a food intolerance, because it's that important that you're talking about that with your vet clinic. So I don't jump into something the first time I see a dog with an ear infection talking about this, but the second time, if they're back in 3 months, they finished the meds, the ear was fine, and then it came back with another ear infection, I'm going to be talking about allergic reactions at that point. And it's something you should bring up at your vet clinic if they're not discussing it, is, doc, do you think this could be an allergy? The other important thing is to know that if you control atopy, you're going to control the clinical signs of vomiting and diarrhea. If you control the food, you're going to control some of the signs of atopy, which is licking, biting, and chewing at their feet and ears. So important to know that those things go hand in hand. We did a whole webinar about ear infections, and so there's going to be a little bit of overlap, but not a lot. So I want you to, if you have dogs with a lot of ear problems, to go back to that webinar that we did about ear infections. So go back, pull that out of the Learning Center and understand what's going on. So ears are really just skin down in a tube or in a hole. So it's really not any different than the skin on the rest of your dog's body. It has hair, they have oils in the coat, they have all the same stuff, but now it's down in a tube. So there's not good ventilation, especially if the dog has pendulous ears, ears that drop down. They don't get good ventilation. Dogs with upright ears like Corgis and Samoyeds have better ventilation, so they have fewer ear infections. The exception to that is German Shepherds. Moisture gets trapped, wax gets trapped. The normal bacteria in the skin and the normal yeast in the skin can go out of control and get to be in very large numbers. And any kind of a skin problem can show up in the ear. So really look hard at the rest of the dog's skin. If you're coming in for an ear infection, it shouldn't just be the ears that your vet's looking at. This is an ad that ran on Hills many, many years ago. That was me looking at a dog when we were doing an ad for their new dermatology diet. And remember, if you want to look in your dog's ears, it's easy to buy an otoscope and look down in there and see what's going on. You can't just look without some magnification and without some light down in there. So what are the causes of your infections? Bacteria, yeast, mites, and allergies. What do they look like? They're going to look like these rust-colored feet because of the chronic licking and chewing and biting. You can see how those feet look. You can see this dog is a dog with an ear infection. They can have bacteria, they can have yeast, which is Malassezia, and it can be around their face as well as on their feet and ears. So it's really common, and it kind of has a yeasty smell to it. So anything that upsets the ear canal bacteria, grooming, swimming, hair in the ear canals, ears that droop, certain breeds, any kind of allergy, narrow ear canals from previous ear infections, foreign bodies like weed seeds, foxtails, any inappropriate cleaning or medication can set you up for an ear problem. How do we treat it? With cleaners, antifungals, antibacterials, anti-inflammatories, and many of our ear medications are a combination of antifungal, antibacterial, anti-inflammatory all in one drug. We can control their allergies with steroids, with Apoquel, Cytopoint, Zenrelia. Sometimes it requires a diet change, sometimes to a prescription diet, which we'll talk about. So ear cleaners, laser therapy. On rare occasions do we surgically remove the ear canal. It's very, very rare to have to do that. But many dogs have ear infections to the point of having a lot of chronic ear disease. How do we clean the ears? What do we do with them? Well, we can use wipes, we can use ear flushes, but mostly we want to get to eliminating the cause. So if we have too much hair in the ear, we want to eliminate that. If we know that the dog is allergic to a beef-based food, we don't want to feed them beef. If we think that they're allergic to a chicken-based treat, then don't give them chicken-based treats anymore. Eliminate the cause as much as you can. We have lots of good products on the market for cleaning the ears. If you're doing an ear cleaning, the first thing you want to do is put solution in, then massage the ear, then wipe it out. And then once the ear is dry, give it a few minutes and then put medication down in the ear and then massage the ear around so that it gets distributed well down in there. So like I said, many of our ear medications are a combination of an antifungal, antibiotic, and anti-inflammatory. That's going to include Tresederm, Panalog and Animax, Momentumax, Positex, Baytril. Baytril is the one that doesn't have an antifungal in it. It's just straight up Baytril. It's good for Pseudomonas infections, but it doesn't have an anti-inflammatory or an antifungal in it. So there's a number of different medications on the market. Most of these are prescription. There's also two medications on the market. One's called Claro and the other is called Ocernia. And these are really interesting meds in that your veterinarian will put these in the ear at the appointment. And when we put these down in the ear canal, we keep them in the refrigerator, and at refrigeration temperature, they're a liquid. But at body temperature, they solidify into a gel that then stays in the ear canal and gives you 14 days of treatment without having to medicate the ear on a daily basis. You put it in once, it lasts 14 days. It's really interesting. So I put butter on here because butter is the opposite of what this gel does. At room temperature, butter is soft, and refrigerated temperature, butter is firm. It's the opposite for these medications. So they're really cool. They go down in the ear canal. So especially if you have a dog with chronic problems that's hard to medicate, these are really valuable medications to take a look at. Oral medications for ear problems are going to include antibiotics, antifungals, and of course the topicals. If we have allergies, we're going to talk about steroids. We're going to talk about bathing your dog weekly. Normal dogs should not be bathed once a week. Dogs with skin problems or allergies, frequent bathing can really help. It removes the pollens and the molds from their skin surface. It removes some of the oils. You can use medicated shampoos that help with bacteria, yeast, and inflammation. So weekly baths may be appropriate for certain dogs with certain skin problems, but it's not how we routinely want to bathe dogs. So if we have dogs with allergies that are affecting their skin, we can use prednisone, we can use Apoquel and Zenrelia, and we can use Cytopoint. So those all help with ear infections, not just feet problems, not just rashes, but also for ear infections. If you have a breeding dog, number one, you should not breed dogs that have allergies. So please avoid that. We don't want to use Apoquel or Zenrelia or steroids on those females. They're not safe. We haven't had any testing done on them, but mostly, why would we breed dogs that have allergies? Let's avoid that. We know that this is genetic in a lot of cases. So let's not produce puppies that are going to have clients having to go forward and medicate their dogs. As good a drugs as Zenrelia, Apoquel, and Cytopoint are, they're expensive. So why would we perpetuate dogs with allergies? I would really recommend that you avoid that. So what do allergies look like with a secondary bacterial infection called a staph or a staphylococcus infection? They're going to be these patches of round areas of hair loss and scaliness, some scabs. A lot of clients will call in and say, my dog has ringworm. Well, yes, this is a round lesion, but this isn't ringworm. This is a staph infection. The good news is they're not contagious to people. Otherwise, I would have it all the time because I touch dogs every day that have skin lesions. So the good news is this is not contagious to people, at least if you're not immunocompromised. How do we treat these? We want to use shampoos and topicals. So creams that are antibacterial, shampoos that are antibacterial can be very useful. If it's a small area of the skin, that may be all we do. If it's generalized, if it's the whole body, you can't medicate the whole body with a cream. So then we're going to talk about Apoquel or Cytopoint, which are going to reduce the allergies. We're going to use an antibiotic for the secondary infection, and they may need an anti-inflammatory if they're scratching, itching, biting, licking, chewing. If we see hotspots are a little bit different than those. These are going to be multiple lesions all over the body. Hotspots are typically 1 or 2 spots, and these are nasty, especially the ones below the ear. They're really hard to get rid of. They require shaving. A laser therapy would be helpful in getting these to heal faster. They require antibiotics, anti-inflammatories, and topical treatment. If we just let these go and we don't shave them out into where there's a normal patch of skin around where we've shaved it, these are going to spread every day. They're going to double in size. And I've seen these just take over a whole side of a dog. So if you think you have a hot spot, which is technically an acute superficial bacterial pyoderma, it's not really called a hot spot, but that's what we call them. They are really uncomfortable for the dogs. These dogs are miserable. They're painful. So get them in and get this shaving done and get your vet to get some medication for your pet. Get these treated right away because they can spread really quickly. If you have the need for a shaver, get one of those and just have one at home. You can buy some really nice ones for $20 and have at home in case you do run into a problem. Lick granulomas are sometimes a manifestation of allergies. They're specifically on the lower legs. Can be back legs, can be front legs, can be one, it can be all 4 legs. These are buggers to get rid of. So I'm not going to go into a lot of detail on this other than to say, if you see one of these, they're chronically being licked and bitten at by the dogs, you need veterinary help. That's going to take more than one veterinary visit. So don't be upset with your veterinarian because these are hard to get rid of. Fourth are going to be skin fold pyodermas. We see them frequently in the brachycephalics, the boxers, the Frenchies, the bulldogs. So cleaning these with topicals, keeping them clean. Sometimes they're on the lower lips on the dogs that aren't short-faced, and any skin fold can have this happen. It can be around the rectum, around the tail. They can be anywhere on the body. But these are, again, something that you have to manage chronically. They're not going to just go away with one treatment. So it does require those special wipes that you can put down in the creases, keeping the hair short, sometimes antibiotics, sometimes anti-inflammatories. And then this is kind of fun because every year in May in Wisconsin, we see no-see-um bites. And they're these red little target sort of lesions. You can see this dog has a bunch of them on his skin, her skin. And you can see that they're pretty significant. They look like a target. They've got a dark center and then a ring out around them. This is not Lyme disease. Lyme disease in people, yes, a target lesion is absolutely classic. It doesn't always happen, but it can. But we don't see target lesions in dogs with Lyme disease or the tick bites. And it's not because of the hair. We just don't think they get them. But if you see these are almost always bug bites, and they'll typically go away within a couple of days. It's really seasonal. Because the bugs are hard to see, they're called no-see-ums. They're like gnats. Eyes, we can see a lot of dogs with conjunctivitis and tearing. They'll have redness and tearing. I like Pataday, which is an over-the-counter eye medication for humans. It is a human product. Talk to your veterinarian about it. If you're wanting to use a steroid eye drop, only do that if your vet is not, if your dog is not squinting and your vet approves it, because if a steroid is used in a dog with a corneal ulcer, it's going to make it worse. So be careful what you use in the eyes. Without talking to your vet first, don't just go willy-nilly putting stuff in the eyes. We have some great wipes to use around the eyes. We have some nutritional products that can help with that. We have some eye washes. So take a look at these if you're having eye problems. Respiratory nasal congestion isn't as common in dogs as it is in people. Asthma is more common in cats than dogs, but again, still not common. I maybe see one asthma case every 4 or 5 years, so it's not common, but it can be very serious, very life-threatening to cats that end up with asthma. Asthma in dogs is really, really rare. It's rare in cats, really, really rare in dogs. All right, what are our treatment options? How do we decide what we're going to do with this dog that walks through the door and it's got ear problems, skin problems, it's chewing at its feet, its ears are icky, it's got a rash? What are we going to do? We're going to go through all of these things one at a time about how we're going to approach this. So what do food allergies like? Vomiting and diarrhea, ear infections, skin, poor interest in food, and let your dog tell you what they like to eat, or cat tell you what they like to eat. Listen to them. They're telling you something important. Food allergies, there's a difference between intolerance and allergy. Does your dog like their food or love their food? If you're not seeing a dog that loves their food, try a food elimination diet. Like I said before, saliva tests and blood tests are not terribly useful. It's a food elimination diet that's really required to figure out what they're allergic to. And typically food allergies don't get better with steroids, Apoquel, or Atopica. So I think it's important to know that. So we're going to go through a dietary history. If you come in, we're going to talk about deficiencies and excesses in the diet and a diet change to improve their skin. So diet history has to be really complete. Every single protein your dog has ever eaten, every single carbohydrate they've ever eaten, we're going to want to know that history. So before you go in, have a list of all the food they've had, all the treats they've had, the name brand. You can bring up the ingredient list. We can take a look. And there are novel proteins on the pet food market, but don't start jumping into some of those really novel ones without your veterinarian involved, because you may burn a bridge and not be able to go back to that protein source if you need to later on. Like I said before, food intolerance is not immunologic, but it's usually GI. And it really just takes a trial of different ingredients. The most common allergens we see in dogs and cats are going to be to beef and chicken. It's not corn and wheat like you may think. There are hydrolyzed protein diets on the market, which means they break the proteins down into really tiny molecules, so small that the immune system doesn't identify them as an allergen. So if we're doing a dietary trial, we're probably going to put the dog on a hydrolyzed protein diet. I'll show you what those are. We may talk about a home prepared diet. And there is a website called balanceit.com that can help you with a nutritionist to develop a home prepared diet, at least for short-term use. If you have to do a food elimination diet with your pet with a home prepared diet because you can't find anything on the market that they'll eat or that agrees with them. And then there are novel protein diets, like I said, alligator, emu, kangaroo, pheasant. Here in Wisconsin, venison is not a novel protein because everybody hunts deer. In Wisconsin, protein like cheese, that's not a novel protein either because everybody feeds cheese to their dogs. So you may have some regionality differences. In England, they don't use lamb as a food elimination diet. We may here in the US, but we're not in England because lamb is on everybody's table in England. So food intolerance, you're going to see dermatology manifestations with certain foods like pork, beef, fish, tomatoes, mushrooms, and spinach, and then other foods with cured meats, fermented foods, and dried or overripe fruits. So you may want to avoid those if you're looking at a food intolerance. Food allergies are different. That's an immunologic response. That's red skin, hair loss, scaling, hives, recurrent staph infections. And this is a cat with miliary dermatitis. Miliary dermatitis is a whole different beast. We only see it in cats. We never see it in dogs. So it is going to give you a whole different look. And cats are a little bit more challenging. The dogs that do have allergies are going to especially be itchy around the rectum as well as the rest of their body, because as the food passes through the rectal area, the proteins are exposing that tissue. So you're going to see some changes in that area. These dogs and cats may or may not have GI signs. They're not going to have seasonality, and they're not going to get better on steroids. So it's different than atopy, the kind of pollens that they're exposed to outside. So 30% of dogs and cats with food allergies have other skin problems. So don't be surprised if you have a food allergy and something else is going on. What are some of the causes of skin problems? Well, it can be dietary excesses. Calcium in excessive amounts can block the zinc absorption, and zinc is required for good skin health. We can see dietary deficiencies. So calcium is in excess. Dietary deficiencies are going to be in too low an amount, or there's some lines of dogs that don't absorb zinc correctly, like the northern breeds, the Malamutes and the Siberian Huskies, the Samis can have this. So they're not common, but it's something to be aware of. We also can see a zinc responsive dermatosis in young puppies. There's two kinds of it. We can see it on the face and on the feet. And we're most commonly going to see these in home prepared diets because most commercial diets have adequate amounts of zinc and they're well absorbed from the body. So if you're feeding a home prepared diet and the skin is getting worse, take a look at zinc as a possibility. We can see vitamin A responsive dermatitis. Again, really, really rare. I don't think I've ever seen one of these. Mostly reported in Cocker Spaniels. It's inherited. So a lot of people with acne are on vitamin A supplements. This is a whole different kind of situation. So I've talked a lot about food, and I'm going to answer for you how a diet change to a dermatology diet can improve the skin and coat. Number one, it removes antigens by either putting them on a novel protein and carbohydrate source or by having a hydrolyzed protein. So it's something that they're not allergic to. It may be an alligator or a kangaroo-based diet. It may be a hydrolyzed protein diet. These dermatology diets also have higher fatty acid levels in them to help soothe the skin. Now, a lot of dogs will put on something like a food trial and will say, okay, for 12 weeks, the only thing you're going to feed are going to be these products. So we're going to be very specific and very careful, but that's not forever. That's for 12 weeks. That's during that food trial that we're trying to figure out what they're allergic to. And then we can go back to adding other things. So if your vet says, I want to put you on a hydrolyzed protein diet, well, not you, your dog or your cat, they make them for cats as well. It's going to be in the Purina line, it'll be the HA. And the Royal Canin line, it's going to be the hydrolyzed protein. And in the Hills line, it's going to be ZD, which stands for hydrolyzed protein. So we're going to see these diets as hydrolyzed protein diets. They're expensive diets, but if you feed these for 12 weeks and your dog's skin gets miraculously better, then we know it's a food allergy. And then we can start adding things back to the diet to figure out how much wiggle room do you have in that diet? Do you have to feed only the hydrolyzed protein diet? Now, if you have a pug, it's not terrible. If you have a St. Bernard, it's a different story because that food gets really expensive really fast the larger the dog is. Then we also have hydrolyzed protein treats. So we know everybody that has a dog or a cat is giving them treats too. Even though your vet may say, now, don't you do any treats? We all know darn well you're going to feed treats. So if you don't have the choice of what else you're feeding and only thing you can feed is a hydrolyzed protein food, the companies also make these treats specifically for the dogs with food allergies. So don't give up. We have something for you. There are also dermatology diets on the market that are not hydrolyzed protein diets, but they are to treat food sensitivities. And they're going to be venison and pea. They're going to be different protein sources, different carbohydrate sources, higher in fatty acids, higher in other bioactives, and lower in calcium, higher in zinc. So there's going to be some fatty acids and some other things that help support the skin. One of the dermatology diets that's recently come to market is the DD diet, and it is egg-based. And egg, remarkably, is one of the least allergenic products that we can feed our dogs. It's still high quality protein. The dogs are still going to get adequate nourishment. So there are some good diets on the market for you to use. But if you're doing this, you have to be really religious about it and don't cheat by giving treats, or don't forget what else you're giving. I had a client that came in. We'd gone through everything. I thought we'd explained it all. We went through everything the dog ate, everything the dog played with, everything they did. They came back 8 weeks later and said, she's not better. And I said, okay, let's go over it again. What are you feeding? What are you giving for treats? What are you doing for water? What bowls are they drinking out of? What are they, eating out of for bowls? And what are they getting for other things? And she said, and I give rawhides. Oh my God, I just realized what I did. And at that exact moment, she realized that she was giving a beef protein to the dog when we had tried to eliminate beef from the dog's diet. It was a chew toy. It was a chew treat. And she didn't think about it as being a part of the diet, but it is. So be really, really careful. These fruit elimination diets are really hard to do if you have really small kids in the house, or if grandma has Alzheimer's and lives with you, because they're going to be feeding the dog off the table and not realizing the significance of that. The easiest food elimination diets that I do in households are either single person households or two people that are wholly committed to feeding a food elimination diet for 12 weeks. All right, other nutrition risk factors that we see that can cause skin problems are going to be malabsorption, the inability to absorb the food from the GI tract, home prepared diets that are not supplemented adequately, diets that are meant to be fed short term. And we do have some prescription diets on the market that are not meant for long-term feeding, or if the diet has too much calcium in it, again, homemade diets. So these all put dogs at increased risk of skin problems that can look like allergies. All right, environmental allergies. We've talked about contact allergies, inhaled allergies, and atopy, which is also a contact allergy. That's to dust, mold, pollen, mites, and strangles. So dust is house dust, and it can be dust outside. Molds can be molds that mold are where the leaves pile up in the fall and they get kind of that funny fall smell that we all kind of like, but that's mold. Molds are in your house. No matter how careful you are, you have molds in your house from humidity. No matter how careful you are, you have a house dust mites. So you may vacuum incessantly, you may dust incessantly, but you're still going to have house dust mites. You just rearrange them when you vacuum. So I know people that are really careful and try really, really hard. I grew up with an allergic sister, and my mother did everything, including putting cheesecloth with starch in it across all the vents to keep all the dust and the dirt down to a minimum. So these are really hard lifestyles to maintain, because our dogs are very sensitive to some of these house dust problems. Skin mites can also make it look like an allergy. And then I'm going to show you a picture of strangles here in a minute as well. So allergy symptoms, we've talked about: itchy skin, chronic ear infections, swelling of the face, skin, ears, eyes, hives, sneezing, licking, diarrhea, and vomiting. All these things are environmental allergies. This is what strangles looks like. Now, I was out of town when my puppy developed strangles. This is also a farm dog puppy. I was out of town when she developed strangles. And at first, when the technician that takes care of our dogs when we're out of town called us, I thought maybe she was having an allergic reaction that looked very much like this puppy, facial swelling, redness. But when we got home, I realized two things. One is she had crusting around her eyes and around her muzzle. And secondly, in that picture on the left, my fingers are on the lymph node underneath her neck. That's a lymph node that's enlarged because of strangles. And that's why they call strangles, is these lesions around the face, the ears, the mouth, the nose are pretty crusty and inflammatory. But when you feel the lymph nodes underneath here, there are these great big giant lymph nodes that weren't there the day before. And that's why they call it strangles, is it almost seems like they're strangling the puppy. Now in dogs, this is an allergic reaction to a staph. In horses, it's an allergic reaction to strep. So they're both sort of a bacterial thing. So they're a little bit different than each other. So strangles is kind of an allergic reaction to a bacteria that's normally on the skin. And this only happens in young puppies. They outgrow it. It's all great when they do outgrow it, but it can be a little bit of a bugger to get rid of. So the difference between strangles and an allergy to an insect bite can look very similar, but there are differences. This is a boxer puppy that has strangles. So why did I list this here? Because it's an immune dysregulation, so something like an allergy, but it's an allergic reaction to the staph, and it requires not just an antibiotic, but it has to, these puppies have to be on steroids. If you don't get them on steroids, they're going to have permanent scarring. They're not going to recover well from this. And it's a real leap of faith for your veterinarian to go from, I think this dog has an infection, to I think this dog has strangles and needs to be on antibiotics and steroids, because we know steroids suppress the immune system, and veterinarians are going to be reluctant to do that if they're concerned that the dog is going to get worse on the steroid. But strangles requires steroids. They also can be treated topically with Domboro, which helps to dry up these lesions. And what our goal is to get the inflammation under control, the lymph nodes to go down, and and not to have any scarring on the face as a result. All right, drug allergies can look like a lot of things. They can look like hives. They can look like facial swelling. These are drugs that you need to in the future avoid for use in that particular dog. Contact allergies, like I said, are anything the dog contacts with their skin. So carpet powders, laundry soap, wool, and other things. Flea bite allergies are really classic. Most allergies are on the feet and the lower legs, the trunk. Flea bite allergies are just above the tail. So if you're having a problem that looks like it could be located here, now cats, it's on their head and on their tail. Dogs, it's on their tail, right above the tail, at the base of the tail. You want to keep them on a product that absolutely 100% prevents the flea bites. So that's a topical, not an oral. I love oral flea and tick medications, but they don't prevent the bite. So you want them on a topical like the Advantage Multi, Advanix Frontline, one of the topicals, Vectra, one of the topicals. Vaccine reactions, these are how puppies can react, or an adult dog can react to a vaccination if they have an allergic reaction. This can happen immediately or within 45 minutes to 2 hours of the time the vaccination is given. It doesn't mean in the future your dog can't be vaccinated again. It means they need to be on steroids, diphenhydramine, pre-treated before the vaccination. And then you sit at the vet clinic for about 45 minutes after the injection before you go home, in case the dog reacts like this, because it's very disheartening to put the dog in the car, drive home, get home, look at the dog and go, oh my gosh, what happened to you? You don't look like the same dog I put in the car when we left the vet. So these require veterinary care and very careful vaccinations going forward. So all of our treatments are going to be listed. Hyposensitization is the only way we can tell as veterinarians exactly what your dog is reacting to. That requires a series of these little tiny injections. This dog is shaved and sedated, and then the little blebs are put of the antigen are put at those black dots. And so about 30 or 40 different antigens are going to be injected under the skin of the dog. And then they're going to look for a hive or a welt or a wheal and determine, based on the size of it, if it's a little one or a big one, what the dog is allergic to. So by knowing this, we can specifically develop a desensitization program with an oral or an injectable product to help the dog react less severely to antigens in the environment. So this is useful for dogs that have atopy, that are allergic to the molds and the pollens and those kinds of things that you can't eliminate from the environment. Food you can eliminate, wool you can eliminate it, but pollens and molds are in your environment. Even if you don't let the dog go out very much, they're still going to have trouble with a reaction. So this is the best way for a dermatologist to tell you what your dog is allergic to and either desensitize or eliminate that from their environment. It doesn't work for food. It works for inhaled and contact allergies. All right, drugs for allergies. We have some pretty great drugs on the market now. We have steroids, which we've had since the 1960s. They're a glucocorticoid. They're going to include things like prednisone. They are anti-inflammatory, immunosuppressive. They are very, very affordable, but they make the dogs drink more, urinate more, sometimes eat more. And if given at too high a dose for too long, can cause diabetes and adrenal dysfunction. So there are some downsides to it, but they're the most cost-effective way. And I still use a lot of steroids on dogs that are in my practice. Antihistamines like Benadryl typically don't work very well in dogs and cats. So I don't usually use them very much because they just don't seem to help as much as some of the other products. The new drugs that we have are Apoquel and Zenrelia. They're JAK1 and JAK3 inhibitors. They block the pathway for inflammation and itch. They're wonderful products. They're given as a tablet. The problem is they are expensive. And Zenrelia has a black box warning on it, which means veterinarians need to tell you that you may either have an inadequate response to a vaccination or a fatal response to the vaccination because of viral shedding. And it cannot be given within 1 to 3 months of the time a vaccination is given. So this has to be used very carefully and timed correctly, at least for now, while the black box warning is on the product. It may go away eventually, but it's still there. There's concerns that if the dog doesn't respond well to their vaccine because of Zenrelia, that the dog may still be susceptible to rabies, and that causes a human health concern. Are there questions about cancer? There are, but there's never been a direct connection. So it's something to talk to your vet about, but there hasn't been a cause and effect developed. So Apoquel does not have the black box warning. Zenrelia does. So be aware of that. There are some dogs that like Zenrelia better, that do better on Zenrelia than Apoquel. There's some dogs that do better on Apoquel, but these are tablets and they're good products, but expensive. And there are some precautions that have to be taken. The newer product that's also on the market is a monoclonal A antibody called Cytopoint. Right now, I believe that's the only monoclonal A antibody we have on the market for allergies. It binds to the IL-31 receptor. So there are some drugs on the human side that are comparable to this, but this is species specific. So dog monoclonal A antibodies are different than human monoclonal A antibodies, can only be used in the dog. And it will block the pathway that causes the sensation of itching and inflammation. So another good product. It's given every 4 to 8 weeks as an injection. Are there some risks? Yeah, there's an occasional risk of GI upset, but every drug on the market has GI upset in dogs and cats. And there's also some question about whether it can cause immune-mediated hemolytic anemia, IMHA. Again, good product. A lot of dogs are much more comfortable on this. We see a lot of Frenchies that are getting this every 4 to 8 weeks. Works really well for those dogs that have allergies. So Apoquel, Zenrelia, Cytopoint, these are all prescription products. They all need a prescription from your veterinarian. And in general, Cytopoint is not dispensed from the vet clinic. It's usually given at the vet clinic, often by a technician. So you don't have to see your vet every 4 to 8 weeks, but you may have to go see the vet tech every 4 to 8 weeks. Other things that can help with allergies are going to be supplements like the fatty acid supplements. We carry a number of them at Revival. We can use a lot of shampoos and conditioners. There can be antibacterial, antifungal, anti-itch products that are used as a shampoo, as a conditioner, as a topical gel. So there's some really good products on the market for dogs that are uncomfortable. And if you can't bathe them as frequently as once a week, then you can use these mousse products that you put on your hands. It's like a foam, like shaving cream, and you put it on their coat. So there's some really good products on the market. If the dog has a wound, we may want to use something like silver honey, which is a combination of silver sulfadiazine, a burn cream, and Manuka honey. So these are good products for topical use as well. So we have good products on the market. Some are prescription, some are not. The silver honey is not a prescription product. Zymox is not prescription. So we have some good things we can do to help you. There's some discussion in the literature about probiotics, maybe lactobacillus, that may help with skin problems, but right now it's still under development. We don't have a product on the shelf that we can pull off the shelf and say, this is going to make your dog's allergies better, but that might be something in the future. And then multimodal therapy, which is really important. And that's like we talked about at the beginning, that dogs have different threshold levels. So if they're allergic to pollen, allergic to mold, and then they eat something that they're allergic to, it blows up on you. So they may be comfortable in the wintertime. They may be comfortable eating bratwurst, but if you combine those, it might be a bad combination of summer and brat and a bun, and the dog's allergic to wheat, the dog's allergic to pork, the dog's allergic to the pollens, the molds, and then they go from being under control to blowing up. So multimodal therapy is really important, and that means getting rid of the allergens and layering different treatments together. It may be a topical, it may be a shampoo, it may be a pill, It may be prednisone, it may be Apoquel or Zenrelia, it may be an antifungal, it may be an antibiotic. So those combinations can be really helpful. The most important thing that you know about allergies is your dog is not going to be cured of their allergy. You're going to manage it. I don't want you to go vet to vet to vet thinking that you're going to a vet that doesn't know what they're doing. There are some vets that are better at managing skin problems and allergies than others, but no vet is going to cure this. Hyposensitization reduces it, but no vet is going to cure this. So don't be discouraged. Don't be upset with your veterinarian. Realize that this is a long-term management program, and you and your vet tech are going to get to be really good friends because you're going to be seeing them a lot. But they're willing to help you work through these things if you're willing to help with a food elimination diet, do the diagnostics, do the medications, and then follow the instructions. If they send you home with an antibiotic for 3 weeks, give it for 3 weeks. Don't quit like, oh, he's better now, I'm going to quit. That's going to get you into trouble. So please follow your veterinarian's instructions. And then one more little bit of tidbit is there's a new product on the market. This is so cool. If you are allergic to your cat or cats, there's a pet food, a cat food called Live Clear made by Purina that reduces the allergens in the cat's skin and a saliva. So if you have people in the household that are allergic to the cat, this is a product that you can purchase to feed the cat. No treats, no snacks, just the Live Clear food. And this may help your pet to be less allergenic to the people in your household. So take a look at this. It's on the market now. Easy to get. Very cool product. Really innovative. Very interesting. So I've talked a lot about itching, licking, biting, scratching, chewing, that sound in the middle of the night. Let's make our pets more comfortable. Let's do this together because Revival can help you with your prescriptions, with the over-the-counters, the topicals. There's a lot of good products on the market that we can do so that Miss Sally here isn't licking and licking and licking herself all night and waking you up. So, Shelley.
Yes, and that is Sally. That is my dog right there, and she does lick a lot at all times of the day. But she is on prednisone, so that does help. When we give her that, it definitely makes a difference. So thank you, Dr. Greer. Great information as always. If you scan the QR code, that'll just take you to our website, where again, a lot of these products Dr. Greer mentioned today, both reminder, we do have a pharmacy and animal pharmacy. So you can get a lot of these from our pharmacy with your vet's prescription. Obviously you need to send that, but you can do that. So a great resource there. Okay, we do have a lot of questions here today. Lila's wondering, well, we've actually had a couple people wondering about canine seasonal allergies during pregnancy and nursing, and kind of what is your advice in that?
Well, first, try not to breed dogs with allergies. And I say that from the heart because I do have dogs that can have allergies. So I'm really serious about that. Prednisone, Apoquel, Atopica, Cytopoint, Zenrelia, not labeled for breeding dogs or pregnant and nursing dogs. So it takes a lot of topicals. You have to avoid steroids. So even a topical steroid like an eye drop or an ear medication or a skin cream can be absorbed in a high enough amount to cause birth defects in your puppies. So you're going to have to use more shampoos that are soothing without steroids. You're going to have to use baking soda baths. You're going to have to do things that are safe. And then probably just consider not breeding her again, because that's a genetic disorder that requires chronic management. And a lot of people aren't going to want to buy a dog that have allergies.
Okay. Lisa says her 3-year-old her dog is 3 years old and has a reaction or had a reaction to her vaccines. And she's just wondering why now, after 3 years. She said her vet prescribed child Benadryl and it cleared up after a few days, but then she broke out again. Is that normal?
No, it's not normal for them to break out again. Once is not uncommon. So yes, Benadryl can be helpful. And then what we usually recommend is that you give fewer vaccines at one visit so that you can start to figure out what they're reacting to and their body's not receiving quite as many antigens and the products that go with the antigens that will affect them to have an allergic reaction. So get that Benadryl and prednisone into them before the injection and figure out which exactly the vaccine is that they're allergic to, so that you can split them up and reduce the risk and try maybe just to avoid, if they're allergic to something that's not a core vaccine, say it's distemper, it's a core vaccine, but you can do a titer instead of vaccinating. So there are ways around it. You want to work with your veterinary professionals on how to figure that out. Your vet wants to help you with that. So talk to them.
For sure. Yvonne is wondering, what is the best thing to feed a dog when their poop is like a cow's? Eliminating chicken from the diet helped some, but not totally.
Sure. So you may need to continue looking at different diets. My favorite diet that's over the counter for dogs with chronic soft stools is Royal Canin German Shepherd food. Now, I know it may not be a German Shepherd. It doesn't have to have big ears, and it doesn't have to be a German Shepherd with a big fluffy tail. I put Bernese Mountain Dogs, I put French Bulldogs, I put my son's Lab on it. So the German Shepherd food is a highly digestible food. So if you think it's an intolerance and not an allergy, that food can be really helpful. If you think it's an allergy, then you may want to move to a diet that's fish-based or beef-based instead of chicken and turkey. A lot of times if they're allergic to chicken, they'll be allergic to turkey and vice versa, because they're very similar. Duck, all those things are in the same category. So don't do any of the poultry anymore. Try to avoid poultry treats and try and get them on something else like the German Shepherd food.
Okay. Somebody's wondering about tear stains. Are they indicative of allergies?
It can be an allergy, or it can be that they have blocked tear ducts. They have entropion. There's a lot of reasons that dogs have tearing. So talk to your vet, have the tear ducts checked, check for extra eyelashes. And then if none of those are the case, then allergies may be well the case. And that's where some of those eye medications that we put on that slide, Pat-a-day and the eye wash and the little wipes can be used around the face. Those can be really helpful.
Okay. Tanya's wondering, are hot spots only on dogs and not in cats, or can cats get hot spots too?
Cats rarely get hot spots. Cats rarely get the kind of allergies we see in dogs. Can a cat get a hot spot? Yes, because it's an acute superficial bacterial pyoderma. Yes, but not nearly as common in cats as they are in dogs, and neither are allergies. And cats don't lick and bite their feet if they have allergies. If your cat is chewing their feet, you need to have your vet take a look, because it can be a liver problem. So that is not how cats react. Cats are not small dogs. Remember, cats are cats.
They have their own personalities. That's for sure.
They have their own health problems, their own things.
Yep.
They're completely different. They are not small dogs.
Are there EpiPen like medications for cats and dogs?
There are. You can actually use an EpiPen, the human one, or you can have your vet prescribe some of those products for you. So having Benadryl, having prednisone, I don't usually have to dispense epinephrine to an owner, but I do have a lot of them that have prednisone and Benadryl at home, in their car, in their first aid kit, at their second home, their vacation home, wherever they happen to be. So if they have that, in case the pet does have an allergic reaction, you want to be prepared. You don't want to have to try and find a vet clinic in the middle of the night.
Somebody's wondering, is it normal to see allergy signs show up around 5 to 7 years old, or will they normally have signs right away at birth?
Usually it's got to be at least the second summer. Now, food allergies can happen when they're under a year of age, but the other kinds of allergies are usually after the second summer. It's not typical to see it between 5 and 7, but it can happen. I mean, people describe that too. There's people that they're not allergic, and then like my dad, when he got to be older, he was allergic to weird stuff like Brazil nuts. Like, okay, that's easy to take out of your diet, right? Because that's not common. But if you figure it out, then you just eliminate it.
Right. We've had a few people ask about, if your dog is allergic to chicken, should eggs be avoided? Are chicken and eggs connected, or?
Not necessarily. That's a great question. Not necessarily. There's a lot of dogs that do really, really well on eggs, but don't do well on chicken. I don't really know why, because it seems like the proteins are all from the same source. But we know the Hills DD diet with egg in it is really a great diet. So it's something to take a look at.
Okay. And then somebody's wondering, how often can a dog be fed a scrambled egg? Like, if they're obviously.
Oh gosh, they can have scrambled eggs every day, as long as they're not getting too heavy. Dogs don't have cholesterol problems, so you don't have to worry about that. But raw eggs should be avoided. Raw eggs can bind biotin, which is a B vitamin. So raw eggs should be avoided so that they don't end up with a biotin deficiency. But scrambled eggs, if you have scrambled eggs for breakfast and your dog looks at you like they'd like some, I don't have a problem. When we use a lot of eggs for dogs that don't eat well or that are having nausea and diarrhea, it's a very gentle protein. It's really easy to digest. I use lots and lots of eggs for the dogs, and not so much for cats, but they can too. They actually make an egg yolk baby food that cats like.
Okay. Aaron's wondering, have you seen a positive response in treating allergies with products like Animal Biome?
I haven't tried that yet, but it gets to that question about probiotics. Is lactobacillus or one of the other probiotics going to help with allergies? it's worth a try. We don't have good documentation at this point, but there's some suspicion that there could be benefits. So it's worth a try.
Stephanie's wondering, is there a test for a food allergy? Or, she said you mentioned the skin test for environmental issues, but not so much.
No, there are tests on the market. There's saliva tests, there's other things on the market, but they are not considered by the dermatologists, the people who deal with all these allergies, to be a very good choice. Really, a food elimination diet, as much work as it is for 12 weeks, it requires, like I said, the whole family to have a powwow and say, we're going to sit down and we're going to really focus on this. And we're just going to feed the food, no treats, nothing extra, and water for the next 12 weeks and see if the dog gets better. That's really the only way to determine if your dog is allergic. So that's either a hydrolyzed protein diet or a homemade diet or a very specific antigen-free diet. And those are the prescription diets. The problem with most pet food is, even if it says that it's only got fish and potato in it, it's produced on a line of pet food where other stuff could have contaminated it. So it oftentimes will have those possibilities of contamination. Whereas if you get the hydrolyzed protein diets or the prescription diets that are made by Hills, Purina, and Royal Canin, when they start their line, they steam clean, they shut down the plant, they steam clean the line, they clean everything up, top of the building to the bottom of the building. I've seen them in the factories do this. And the first diets that they'll produce on that line are going to be the hypoallergenic and the hydrolyzed protein diets. And then once those are in the bag, out the door, then they'll start putting other things in the line of the production. So if a little bit of chicken sneaks in to a regular cat food or dog food, it's not going to hurt them. But the hypoallergenic and the hydrolyzed protein diets are made with high careful quality to make sure there's no contamination. So the prescription diets cost a little more, but for 12 weeks, they're probably worth it.
Mm-hmm. Okay, good to know. Somebody's wondering, is pododermatitis in dog paws related to an ear hematoma?
It can. Hematomas are kind of interesting because they sort of spontaneously happen. That's when the ear puffs up. And we did talk about this during the ear seminar, where the ear fills with blood and it gets all puffed up and weird. Pododermatitis is just a description of dermatitis on the feet. Podo meaning feet, dermatitis meaning dermatitis. So dogs with ear infections and dogs with infections in their feet can have an ear hematoma, but you can have a hematoma for absolutely no reason. Like the dog can have perfectly normal skin, perfectly normal ear canals, and one day the dog just ruptures the blood vessel in their ear and it fills up with this blood. It looks like a little pillow inside the ear. They can happen spontaneously. So there can be a connection, but there's not always cause and effect.
Okay. Tanya's wondering, are only some cats and dogs able to go into anaphylaxis, kind of like people?
Any person, any dog, any cat can go into it. It's just what your immune system reacts to. So most people never have an anaphylactic reaction. Most dogs and cats never do, but it's possible in any breed, any age, any species. Anything can happen.
Is it common to see allergies start after a dog has a splenectomy when they've never had signs in the past?
That's a really specific question. I suppose it is, because the spleen is one of your immune organs, and changing the immune system by removing the spleen could set them up for some changes. I can't say that I've seen a splenectomized dog do that, but anything's possible.
Somebody's asking about how you mentioned keeping Benadryl and a steroid on hand and whether you need a prescription for prednisone. And
You do.
I do, yes, because my dog,
Yes,
my dog
you
takes
do.
that.
But if you have a dog with allergies, your vet is probably going to help you with a prescription. Benadryl is over the counter, but even any over the counter drug should be something you've discussed with your veterinarian, because you shouldn't be using a non-dog drug without your veterinarian's input.
Mm-hmm. And make sure, if you do get that prescription, check out the Revival Pharmacy, because we do carry a lot of these prescriptions, and then you don't have to go to the vet so often to get them. You can just have them delivered to your door. So
Right. And there is a chewable veterinary form of Benadryl called Vetadryl. So if you have a dog that's difficult to medicate, it's easier to use that. If you do use a children's Benadryl, make sure it doesn't have xylitol in it as a sweetener, because remember, xylitol can cause low blood sugar and seizures. So check the label. So turn the bottle around, look at the little tiny fine print on the back, and make sure it doesn't say xylitol.
okay. Patty's wondering, do you have a good recipe that you use for homemade food for dogs with the nutrients necessary? Any
I go
recommendations?
to the Balance It website, and there's also a good diet called Home Cooked Diets for Dogs and Cats by, was the original copy was Donald Strombeck, That was first edition. There's a second edition out with a new author on it. And so they have all kinds of categories in there for kidney problems, liver problems, allergies, heart disease, all kinds of stuff. So it's a really great resource. You can buy that book on Amazon and use it. And it does have all the supplements in it that you need to make a balanced diet. So if you're feeding something short term, a few weeks, you don't have to worry too much about the vitamin and nutritional supplements. But once you get out a little ways, if you're not adding supplements to it, you're probably going to end up with a dog with a dietary deficiency and some health problems as a result of that. So you do want to make sure that you're following your veterinarian's instructions or using a resource that can help balance the diet, because most of us are not nutritionists. Most veterinarians are going to defer to a nutritionist for that.
Kelly's wondering, how do you feel about Heska allergy shots once a week while the female is pregnant?
As long as she doesn't have an adverse reaction to it, it should be okay. But I'm going to ask you again, why are you breeding an allergic dog? So a lot of people with Frenchies are breeding them. I have some pretty strong feelings about breeding allergic dogs. So I think they shouldn't be in your gene pool. And I'm pretty much pro breeder. So I don't want to sound like I'm anti-breeder. I want to sound like I'm anti-breeding health problems.
Okay, Christine is wondering, she says her Australian Shepherd has terrible skin reactions, flaky and a rash. She's given her Bravecto. You'd mentioned also applying a topical to prevent the flea bites. Is there one that's still effective, like a topical for in that case? What would you recommend?
Yeah. And you can actually use the oral and the topical on the same dog at the same time. So you can use Bravecto, Credelio, NexGard, and Simparica with the topicals, Advanix, Vectra, Frontline. They can be used together because the mechanisms of action are different. So together they can be really helpful. It's just, if it's a breeding dog, make sure that you're using a product that's labeled for breeding dogs. So if it's an oral, that's Bravecto.
Okay, what are your thoughts on Fortiflora for dog allergies?
I think Fortiflora is a great probiotic. I don't think we have any documentation that it helps with allergies, but if your dog is better, great. One of the products that I mentioned for feline is a Royal Canin product called Calm, and they actually have a probiotic and some tryptophan and some other things in that help to calm the pet. Fortiflora has a Calm probiotic as well. So some of these probiotics do seem to help with the dog's attitude or the cat's attitude and calms them. So if they're uncomfortable from their allergies, it might help with that as well. So look at the Calm probiotic from from Purina, or the Royal Canin Calm diet for cats.
Okay. Patty noticed her pet has somewhat gooey eyes every morning, and she's wondering, is this probably allergies? She noticed it gets worse when spring started with all the grass and air.
Yeah.
So.
If it's worse, then yes, it probably has a component of allergies to it. So you might want to get the Pat-a-Day. If your vet approves it, you may want to do the eye wash. Remember, we all have eye discharge, dogs and cats do. If they had fingers, they could get a Kleenex and they wouldn't need you. They would buy their own food on Amazon and they wouldn't need you. So yes, discharge is not unusual. If it becomes excessive, then it's probably got an allergic component to it.
Okay. Somebody's wondering about a distemper shot in a 7-week-old puppy, if it can cause paralysis 8 to 10 days later. If that
It should not. No, it should not. And I've given a gajillion distemper vaccinations in my career. I've done this for 44 years. I vaccinate dogs every day. I've never seen a dog become paralyzed from a distemper vaccination.
Okay. Let's see. Somebody's asking about the silver honey again and the
Yeah.
Zymax again. Can you talk about those two, what they're for specifically?
Sure. Zymox has a couple of different products. So does Silver Honey. Zymox has skin creams. They have ear medications. They have a number of different things depending on what you're trying to treat. So you just need to go on to their website and take a look. We carry some at Revival. So they have skin creams, they have ear medications, ear washes, all kinds of things. And the same with Silver Honey. There's a spray, there's a cream, there's an ear medication. So they are, neither one are prescription products. So they're things that you can get without a prescription, and they are labeled for use in dogs and cats. So, just look to see what you're trying to treat, if it's ears or skin, or, what component of that you're trying to treat, and pick the right product from that.
Okay. Linda said she's had some cats that are seriously affected by food thickeners. She's had a kitten die and a male adult got really sick. She's wondering, do you have any more information on food additives with weird sounding names for birds?
No, I'm not sure what food thickener she's talking about, but I'd be happy to correspond with her by email.
Okay. Okay. Um, can you do skin testing on a cat?
I believe they can. So yes, like I said, allergies are not as common in cats, but if you have an allergic cat, they can be really hard to really hard to medicate, really hard to treat. Atopica does have a cat version, but Cytopoint and Zenrelia and Apoquel does, I think, have a cat label on it. Zenrelia doesn't, Cytopoint doesn't, because those are canine specific. But yes, I believe cats can be skin tested. You'll probably want to see a veterinary dermatologist and set up a consult with them to see if that's an option for you.
Okay. Jackie's wondering, is reverse sneezing a good sign of environmental allergies?
It could be a sign of any kind of irritation in the air. Dogs that go to dog shows, they walk down at the lower level than we do. You know, they're down at our feet, dust, dander, hair, all that stuff gets up in their noses and they have a lot of reverse sneezing. So any kind of irritant in the airway. So it doesn't have to just be allergic to cause reverse sneezing. And if you've never heard a reverse sneeze before, it's exactly what it sounds like. It sounds like the dog is trying to die. So if you're really curious and you've never seen one, Google it and look at a video of it, because it sounds like the dog is going to keel over dead any second. Sounds horrible. Basically, the epiglottis and the soft palate get on the wrong side from each other, and they start to. And as soon as you pinch their nostrils closed, but let them open their mouth, because if you hold everything closed, they can't breathe. So pinch their nostrils and it flips it, and then they stop. They may start again, but at least you can stop it. It sounds really scary the first time you hear it, but any
Yeah.
irritant in the airway can cause a reverse sneeze. It doesn't have to be an allergic reaction.
Our previous beagle had that
Oh,
all the time. He would, the first time, like you said, I was like, what is happening to him?
I
But
know.
yeah,
You're pretty sure they're going to die before you get there.
yeah,
And then
but
they're like, oh, what? I'm good.
yeah, and then he just walks around. I'm like, really? Like, what just happened to you? But who knows? Um, Somebody's wondering, is terramycin or other antibiotics something that can or should be given without a vet seeing what the issue is?
Terramycin has no veterinary prescription requirement. At least it hasn't in the past. I'm not sure. It was off the market for a little bit. Um, I'm really careful with antibiotic use without a veterinarian's involvement, but terramycin works really well for cats with eye infections, like upper respiratory things that we see in cats. But it's also a very irritating antibiotic. It stings a little bit when you put it in. So I'm pretty careful how I decide to use it or not use it.
Okay. Oh, a follow-up for that thickener question. Linda just put in, it's a gravy thickener. It was dangerous for cats is guar gum, Guar gum.
I didn't know that was dangerous for cats. I'm gonna have to take a look at that. Yes, I've seen that on a lot of human products. I'm not sure what the status of it on the veterinary side is.
Okay. Lila's wondering, is it common to have an import dog with no known allergies to get seasonal allergies? And if so, what do you recommend? How do you determine if the dog or female is allergy prone in regards to a breeding foundation?
Well, I mean, an import dog, any dog can develop an allergy, whether they're imported or not. It's just what they were exposed to in the past life. If they were in another country and they didn't have some of the allergens that we have, they could become allergic after exposure, but they're not going to be allergic until they've had that exposure. There's no way to predict who's going to be allergic and who's not, other than to just try and breed the best genetic set you can. And allergies are basically diagnosed on physical exam and history. There's no good test that your vet can do in the office unless they refer you to a dermatologist. It's really hard to diagnose some of these.
Mm-hmm. Yeah, Sandy says her Newfoundland chews her front feet. She's
Mhm.
inspecting them. She sees no redness or irritation, but she's assuming it's an allergy of some sort. But
Good assumption.
yeah.
Yep. And I have people that come all the time, like that picture I showed you of the white dog with the brown feet, that porphyrin staining of the feet. I'll walk in the examiner and I say, oh, I see your dog has been chewing his feet and he's allergic. And they go, no, he's not. It's a white dog and its feet aren't the right color. Your dog is chewing his feet. No, he's not. Oh, okay. But he is. So it's kind of funny to me that they're either in denial or so unaware because Sally's chewing and licking and biting and scratching.
Oh yeah.
It's pretty hard to miss.
Yep.
And if they lick enough to turn their feet brown, they've been licking quite a while.
Mm-hmm. Nancy says her 3-year-old breeding female gets red around the top outside of her vulva. It's been happening now for the past few weeks, but not always present. She tends to lick it often. She's wondering what could be causing this. What tests should she ask her vet to perform? Are there any home remedies she should be trying, or would food elimination be helpful in that situation?
Yeah, usually licking the vulva is not a food allergy. I would be looking at, is she in heat? Does she have a vaginal polyp? Is she dribbling urine so that she's always wet and then therefore she's licking? Does she have a silent heat cycle? I'd be looking at some of those things related to the urinary tract and the reproductive tract, but not so much allergies.
Lisa's asking about flea control for the yard with the flea allergies. It sounds like they've kind of had, a lot of an outburst of flea explosions
Yeah.
in the yard. So, do you have any, you know, tips on that to kind of control that? I know we do have a lot of resources in the Learning Center on flea control plans. We did the external parasite webinar about a year ago. So those are resources, but do you have anything to add to that?
Well, there are some exterminators that will come out to your home and help with yard treatment, but you can use a combination of the oral and the topical. So the pills, unless it's a breeding dog, any of the four are fine. That's Bravecto, Simparica, NexGard, and Credelio are the four orals. And you can use a topical as well. You can use the Seresto collar as well. So you can do all three if you want to, because they all have different mechanisms of action. And if you have a big flea population problem, like we don't have a lot of fleas in Wisconsin. Maybe every 10 or 12 years, clients will come in with fleas. And it's even less now because of all the flea and tick preventives that we're using. But if you live in Florida or you live in Alabama, you got fleas. It's really hard to manage. So you may have to do all of those things to get good flea control. And a normal dog, a couple flea bites a week isn't going to set them off. But an allergic dog, they're going to just lose their minds because they're so itchy. So, it's right above the rump, right above in that little triangle above the base of the tail that you're going to see the hair loss and that's where the fleas hang out, which is why that's where the skin is that breaks out so much, is if you ruffle the fur or you take a flea comb over them and you can find the fleas, you got a problem.
Charlotte's wondering what is good to use on lip fold dermatitis.
Shaving. Yeah, shaving first to get rid of all the extra hair. So just pick up their lip and get your little $20 Amazon clipper. They make little rechargeable USB ones that are real handy and quiet. They're little rectangles and they're really nice to have. So shave the hair. And then I use chlorhexidine or any of the wipes that we carry for the skin to keep that clean, especially after a meal. A lot of dogs will end up with those lip folds and they get really smelly to the point that people come in thinking their dog has bad teeth. And it's actually the skin infection is so bad that it just smells terrible. So a couple times a day, you have to lift up their lip and wipe out that little fold, kind of stretch their lips out so that you get in that little crevice. That works the best.
Okay. What sort of topicals they're wondering would you recommend for that? Like, is there
I use the chlorhexidine. You could use silver honey. Any of those topicals that are antibacterial, antifungal would be fine.
Okay. Back to the eggs again. Somebody's wondering, would eggs be safe for a dog being treated for PLE?
It should be, unless the dog, PLE stands for protein losing enteropathy. As long as the dog doesn't have an allergic reaction or a negative reaction to eggs, it's a really good protein source. So yes, there are sometimes that it requires a hydrolyzed protein diet to manage the PLE. Sometimes it requires steroids. Some breeds have more problems with PLE than others. So I would need to know more about the dog. In general, eggs are fine, but I've had some dogs that had to go on a vegetarian diet with their PLE because we couldn't control it with anything else. And Purina does make a vegetarian diet that has worked for some of our dogs with really bad PLE.
Josie's wondering, is chewing and licking always a result of an allergy? Can you assume that
Almost always, yeah. Like I said, we see allergy dogs every day, all day, and we're in a part of the country that isn't as bad as certain warmer climates. So yes, almost always, if a dog comes in with those symptoms, it's like it's allergies, and then people just they want to fight you on it. They're like, it's not allergies, it's allergies, man, it's allergies. And then they laugh and they're like, yeah, everybody in my house is allergic. I guess the dog might as well be allergic too. Sorry.
Yep. Somebody's wondering, you've mentioned many times foods with EPA and DHA in a few webinars. You've mentioned those. Which, can you again mention those? Which ones have you found to have the most of the DHA and EPA in them?
Yeah, the dermatology diets are really going to be your best bet. And those are going to be the Hills, Purina, and Royal Canin diets that are meant for skin problems. So they're going to be diets like these, the ProPlan Derm diet, the Hills, the canine and feline DD diets. D stands for dermatology. Hills names all their diets with a letter that goes with it. So ID is intestinal diet. ZD is hydrolyzed protein because H was taken for heart. ID is intestinal diet. Purina has their derm diet. Royal Canin has their derm diet. And like I said, the feline diet is also a calm. They include something in it to calm the cat as well as helping with their skin. So we have all these really nice dermatology diets that are higher in fatty acids, that help with skin integrity, help with less inflammation, inflammatory changes. So they're less uncomfortable, less likely to bite, scratch, lick, chew, and less likely to break the skin. That then allows a secondary bacterial infection. So if you have a dog or a cat with a skin problem, going to one of the derm diets is going to almost guaranteed improve their skin quality unless they're allergic to the protein in it. And then you go to a hydrolyzed protein diet.
Okay, we have a couple more questions. I won't get through them all here.
Oh, we're knocking them out.
I know. Joyce is again you mentioned the clipper, I think, regarding the lip. Is there a specific size or anything? I know we do carry a lot of clippers at Revival, different sizes, a trimmer versus a clipper versus any recommendation.
Yeah, I like the clippers with a 40 blade. So it's going to give you a really clean cut without leaving any stubble or anything left behind. That's the clip thing that's the level of clipping that your vet does for a surgical clip. So a 40 blade is going to be the best. Some have rechargeable, some have cords, some have replaceable blades that you can send out to have them repaired or sharpened or cleaned. So it just depends on how much you're going to use it, whether your pet is affected by the sound of it. The quieter, smaller ones are really nice. You can kind of sneak in there and do stuff quietly. They always have a little vibration, so the pets aren't unaware of it, but they're less likely to be intolerant if it's a quieter clipper than a loud clipper. Some of mine sound like lawnmowers. I mean, they sound terrible.
Patty's wondering again about the reverse sneezing. Do you recommend gently rubbing their throat when they're having this happening, or not necessarily?
Pinch their nostrils and just let them drop their mouth open. So just hold their nostrils closed. They'll drop their mouth open and take a nice deep breath, and then it'll stop.
Okay. Okay. I wish I would have known that when my beagle was still around.
Never asked.
I know. I didn't think. Well, I think we got through all of the questions that I see here.
Oh.
So again, thank you so much, Dr. Greer, for joining us today. Again, my name is Shelly. I'm the content manager at Revival Animal Health. Have a great rest of your day. Thanks for watching. Make sure to subscribe to our channel so you're up to date with all of our latest videos. If you have an animal health question, be sure to give us a call at the number below and check out our other animal health videos.